Hi, good morning. I'm not sure if this image is capturing me correctly because I'm doing it myself and I don't see a screen where I could see what I'm shooting. But anyway, yesterday I had the procedure with Dr. Sam Lamb in Dallas, and it was the most pleasurable experience I have had with a procedure of this type, because I have had two in the past and they've been pretty traumatic, painful, just a lot of discomfort during them. On this occasion, I got there first thing in the morning, 6:30 in the morning. Dr. Amina immediately sent me to the back, started me with my asking questions, having to get my robe on, getting into the surgical area, and we asked questions back and forth. We wanted to be clear as to what the expectations were, which we already had gone through that on the initial consultations, but I wanted to further just ensure that we were all on the same page still, because I know they have a lot of cases that are very successful, and I wanted mine to be one of those as well. Like I said, I had the procedure yesterday, and it was like from 7 a.m. and I think I left the building like at 5:30ish. They take their time. They're not going to rush things. When I asked when could my ride be here, they said we'll call because we don't really know. It'll just be a matter of when we get there, and as we get there we'll know more, because mine was it was a rather large procedure. I'm very happy in that I found Dr. Lamb, because after doing a lot of research online, I did find a lot of surgeons that did things that I wanted to get done, but none of them made me feel as comfortable as Dr. Lamb, because there are so many YouTube videos out there that show him lecturing on the procedures, on the specific areas of the head. My main concern was my wide forehead. I wanted it narrower down. So whenever I tried to do that with my previous surgeon, after two procedures previous, they indicated to me that they did not do any temporal point implants because it was just too risky and they were not experienced well enough on that, and that may be something in the horizon, but that's something they simply don't do. So what I was left with was a semi-adequate hairline, but you could still tell that it was not a natural hairline. It had more of a lid effect because it just flapped over down or to the side, but I had nothing on the sides that matched the lower forehead that they had created for me. I got really excited to find Dr. Lamb in all his videos showing that not only do they lower the forehead, but they could also bring it in from the sides to make it a more appealing forehead and appealing face in general. So I took the chance and I made a consultation. Immediately I felt very comfortable with before and after photos, with the experience these folks have had. Again, Dr. Sam Lamb and Dr. Amina there, they are super experts in hair transplant and hairline design. They explained to me the intricacies of the hair, how it grows. That on the temples, the hair grows downward along with the skin, along with the lines, the face. Where some doctors may or may not transplant the hair where they're perpendicular to the head so they stick out. So that freaked me out. Like, I just wanted to be sure that I knew that I was going to people who knew precisely how the hair grew. That it grows down in certain areas, back a certain areas, out a certain areas, and in the swirls of the back of the head, they follow that natural design. If there's a natural design already there, but it's just lacking a lot of hair, they will pick it up and they will follow that natural design, and they're just brilliant. The first few hours I was sedated to where I was asleep. I don't recall any of the first few hours, and around lunchtime I was awakened, and to my surprise they brought me some lunch. It was delicious. They brought me coffee, and they even got me some cookies, which I'm a sugar person, so that was great. And after that I was wide awake, feeling no pain whatsoever, and I did feel a little bit of sensation, I believe on my left temple, but that's because medication was wearing out. But they did tell me, as soon as you feel anything, you let us know. So I let them know, and they immediately administered some more medication. Everything was fine. So I walked out of there pretty much in the condition I am. I think this morning I woke up with a little bit of swelling. I could feel swelling on my forehead and around the temples, so I looked a little different than I normally do. A lot different because I haven't showered. I clean up decently. But I just wanted to show for people that are very curious about this procedure and whether they should think about their temporal points and all that. I have always hated taking profile pictures, and whenever I had to, I would try to do something like this to cover it, or something weird, just something to just not let it show so much. I'm going to turn to my sides, and you'll see to the degree where they were able to help me. And again, this is just post-surgery yesterday, not even 24 hours. But you will see, hopefully you'll see on this video, the transition between my natural temporal point that was there. It's just a straight line pretty much. They were able to go in and add these angles. I can't really see that. I can't see because I'm not in front of a mirror. But they go, they just go beautifully out to where they should. I'm very meticulous, and I really analyze a lot of people's eyes and hair and where temporal points are normally at, or people that are considered like, better looking, if you will, or more aesthetically pleasing, to the eye. I do notice that their temporal points go up just a little above the eye, not into the eye, but kind of to the corner of the eye, or a little bit more than that. Anyway, so that's my left side, and now I'm going to turn to my right side. And you'll note that the symmetry is just perfect. Amina did a great job. They will take a ruler and measure the points from your eye to where the proposed temporal point should be. And I'm just loving it so far. When I'm looking at the photo, like if I look in a mirror and I look at a side view using two mirrors, oh my gosh, I'm so pleased. And then when I look straight on, I do not see that wide, tall forehead that I had. That was not proportionate at all to what I believe my face should be. Whenever I wore a baseball cap or hat, I looked better because I covered up those areas that were not symmetrical to my face. Now it's my belief, and I really believe that just being able to walk around with nothing on, it'll be an automatic improvement in the symmetry of my face. So I'm happy with it, and I will keep you updated as I progress. I have an appointment today, a follow-up appointment, and I believe my sutures come out like 10 days post-op, and I will take another video then, and I will keep you updated. Thanks. Bye-bye. Hi, good morning. I'm not sure that I covered this on the previous video I just did a few minutes ago, but I was so excited about the temporal point piece that I forgot to mention my hairline. My hairline was lowered, and I'm not sure exactly like the measurement it was lowered, but I would say just by eyeballing it, it's maybe 1.5 centimeters. Extremely happy about that. In the past, I felt my forehead started up here. In fact, I had a friend recently who I told I was doing this, and he said, "Your hair looks fine." He says, "I know it starts up here, but it looks fine." Well, to me, it didn't look fine. So when I went in to see Dr. Lamb, they also addressed clearly the hairline, which is the hairline and the temporal points were my concern. My concern was, have I have enough hair? And they said, absolutely you do. And clearly I do. So I'm going to take a shot. I'm going to try to move the camera where you could see the top of my head, and you'll see where hopefully the old hair was and where the new transplants are. And so what they did is that Not only did they do the temporal points, they also brought down my hairline to a very adequate level. In fact, this morning I was touching my forehead to see if it was swollen, and I went up and I said, oh my God, there's hair. Normally I would have been going up and up and up until I felt the hairline way up there. So it's amazing what that's done for me. But I'm going to keep going up because what they also did is they reinforced and they added hair to my central forelock. I think that's what it's called. But anyway, like the very top of my head, not just the forehead, but the very top. I had the previous transplants there, but it was becoming thin because my natural hair that had not been transplanted had been falling out over the course of 10, maybe 15 years. I want to say my other two transplants were done about 10 to 12 years, ballpark. I don't remember. So they did that central location, but in addition to that, my bald spot in the back, I really never had a problem with a shiny bald spot, but over the course of maybe 8 to 10 years, I noticed a little bit of receding over time, where maybe the last 2 or 3 years, it really got on me because I started to get a lower haircut, and it was kind of very evident whenever I got the haircut. But I'm going to put the camera up there. Hopefully you can see. I'm going to turn around so you can see in the light. So this is the crown, as they call it. I hope you can see that. So anyway, I know I'm not dressed to be making high quality videos, but I really wanted to do this before I got on my way and got ready to head out the door and stuff, and I didn't want to forget to update you guys on this. But anyway, cheers, thank you. Good morning. Well, this is the third day post-op, and as you can see, I've experienced some swelling. I did have a mega session, so a mega swelling is probably not too far-fetched, so here we go. It's not so bad. When I woke up this morning, it was a little worse than it is now. I guess as I walk throughout the day, the swelling may kind of like dissipate a little bit throughout the day, and that's what I'm hoping for. But if I wake up like this again tomorrow, it's not a big deal. I know that it's a few days for recovery on that. So anyway, I just thought I'd update you, see if I can show you some of it close up. I'm not sure how well the picture is on this because I am not able to see what I am recording. Anyway, I will keep you updated in a couple days, or maybe tomorrow. Thanks. Good morning. It's a little after 11 a.m. on Thursday. I am 3 days post-op. I made a video earlier today when I got out of bed, but I forgot to mention that at that time I had some moisturizing cream that I had placed last night on it. That was part of the post-op instructions to enable the grafts, or not the grafts, but the crusts to, I guess, become a little more loosened and heal quicker. So I did that, and the purpose of this particular video is to show you after taking a shower how it looks. I've dried my hair with the blow dryer on cool, very low setting, hardly touched my hair, and I will go ahead and show you the areas that I had done. I had the temporal peaks done, I had the hairline lowering, and I had, I think it's called central forelock, and I also did the crown. So it was a mega session, over 3,000 grafts, so it was a pretty long session. Very happy with what I'm seeing so far. I will go ahead and show you at this time what was done. Thanks. That's it for now, and I'll update you later. Thank you. Hi there. Just thought I'd take a video real quick to show you what I will look like when I get out of here in the morning. As you can see, I got a few beanies. This one's a black one, so that's what I'm going to be wearing the next few days for a while until I look kind of like normal around the grafted area. So anyway, I just thought I'd show you that there is a solution to going out in public. Thank you. So I had my surgery 4 days ago on Monday. It is now Friday, and this is how I look today. I kind of did my hair down a little bit. Today I was comfortable to go ahead and blow dry it on cool, setting downward, kind of touching it down and making sure it stays down. So it's kind of covering the front kind of decently. I'm still not going to go out in public without my beanie, but I just wanted to show you how it's coming along. I still have some of the swelling and a little bit of bruising under my eyes, probably the bridge of my nose. I think I look kind of weird a little bit still around here, but I'm getting better, and I will go ahead and move the camera around so you can see the sides. I'm going to lift the front of my hair so you can see the work that was done underneath and how it's looking so far. So like I said, I just slightly covered it over, and I'll go ahead and show you the top too, the crown where they did. So that's it. I will update you here in the next couple days. Thanks. Hi, good morning. Today is day 10 post-op, and I will be getting my sutures removed today. I wanted to just quickly show you what has progressed since my surgery. And as you can see, I still have the hairs that were implanted or transplanted. And I'm not sure if they will fall off. It's my understanding that they fall off from anywhere from 2 weeks to a couple months, and then they will grow again. It'd be nice if these stayed on and kept growing. But anyway, I just also wanted to tell you that for public appearances, I've been, when I go to have dinner or whatever, I cover my head with this beanie, and I will show you now how it looks. So I'm going to set this aside for a second. So yeah, that's how I go outside, and not too bad. And it being late fall, it goes with the season. So anyway, just thought I'd give you a quick update. Thank you. Bye.